Welcome to this edition of Forthright and a very personal commentary following this column. The column published October 26th, 2023 in the Spokesman Review, Shining a Light on Money in Politics. And I will start with the editor's note, since this was first published during the general election. The editor's note added that this column reflects the opinion of its writer and should not be considered an endorsement by the Spokesman Review. Standard disclaimer, absolutely right. This column reflects my opinion. Everyone says they want to get money out of politics, or at least they want to know where the money is coming from. So when the opposition to Measure 1 raises 96% of its cash from two opaque nonprofits, it catches the attention of political watchdogs. According to current reports filed with the Public Disclosure Commission, Jobs for Justice raised $34,250 from individuals and businesses in support of Spokane County Measure 1. Justice Not Jails raised $520,394 cash and in-kind donations to oppose it, with reports showing no cash donations from business or individuals. It's not a setup for improving public policy debate. Voters will be inundated with one-sided campaign advertising from jail abolitionists targeting voter turnout among progressive urban precincts. The case for upgrading the jail to meet today's behavioral health and addiction challenges will have to depend on voters digging deep before making up their own minds. It will require higher voter turnout in areas of the county where there may not be much on and off your ballot. Proponents of Measure 1, which would authorize the county to collect an additional 0.2% sales tax dedicated to criminal justice, law enforcement, and behavioral health, have as their champion Sheriff John Knowles. The sales tax would not apply to the purchase or lease of vehicles and would amount to about 7 cents on the purchase of a snow shovel at Walmart. The jail abolitionists at Justice Not Jails have chosen Stanley Harewood as the face of their campaign, a man who pled guilty to second-degree murder in the death of 3-year-old Pasheen Bridges in 2001 to avoid being tried for first-degree murder. Their campaign pitch consistently cites the estimated total of $1.7 billion for the shock value, while neglecting to mention it'll be paid by anyone buying anything in Spokane County over the next 30 years. Justice Not Jails also appears to be in violation of Public Disclosure Commission requirements by listing Empire Health Foundation as one of their top 5 donors. As a 501c3 nonprofit, Empire Health Foundation is not allowed to dabble in politics. Its mandate is to focus funds on community health. The foundation does operate a 501c4 subsidiary called the Empire Health Community Advocacy Fund, which was the source of a $240,500 cash donation to oppose Measure 1. It would behoove Empire Health Foundation to insist that its name be removed from all Justice for Jails campaign materials before the IRS takes an interest in its dive into the highly politicized social justice pool. And stepping out from the column for a second, Empire Health Foundation did indeed make that insistence to Justice for Jails, which changed their website, but they've not done anything to address the mailers that they've sent out, and they likely won't. Back to the column. Justice Not Jails can afford to reprint literature, fix their website, and update their broadcast advertising. They have $240,500 from the Empire Health Community Advocacy Fund plus $240,500 from the Seattle-based Inatai Foundation to spread around. Both foundations may also have their own problems with the PDC. As 501c4 nonprofits, their sources of funding are subject to disclosure under RCW 4217A207, also known as the Disclose Act, when they make donations exceeding $35,000 to any one campaign. Neither nonprofit has filed the required documentation, leaving responsible voters in the dark. Again, stepping outside the column for a second, I've been told that the Inatai Foundation has filed a C6 form, although the PDC website is down. I can't confirm that right now, but Empire Health Foundation or Empire Health Community Advocacy Fund has not filed a C6. Back to the column. To refresh Spokane County voters' memories, in 2018, Senator Andy Billig, Democrat of Spokane, championed the Campaign Finance Transparency Bill following a fight over campaign funding, opposing a statewide initiative requiring labeling of genetically modified foods. The Grocery Manufacturers Association funneled corporate funding through a nonprofit to provide anonymity for its donors. Billig described it as a victory for citizens across the political spectrum in his statement issued after passage of the bill, saying, "The bipartisan Senate vote tonight on the Disclose Act takes us one step closer to shining a light on dark money in Washington state elections. Campaign transparency increases accountability, reduces the opportunity for corruption, and strengthens our democracy." Spokane County Treasurer Michael Baumgartner, then a state senator, also voted in support, along with 6 other Republicans. Attorney General Bob Ferguson pursued the Grocery Manufacturers Association over campaign finance violations for 8 years. He released a statement after the settlement was reached in 2022. "My office will be relentless, ensuring dark money special interests that intentionally violate our campaign finance laws will be held accountable, even if it takes a decade." Well, one wonders if the new Attorney General will be as relentless as the old, and even-handed in application of the campaign finance laws, as the Washington legislature intended. Transparency in campaign finance is truly a bipartisan issue. Ballots are due in the mail or in an official drop box on or before November 7th. Get it done, and get it done responsibly. Now, at the bottom of each published column, the newspaper runs my contact information. It says contact Sulani Madsen at rulingpen@gmail.com. At the bottom of this column, I added the following disclosure. She served on the founding board of the Empire Health Foundation and is a past board chairman. And I'm a really irritated past board chairman, and I wouldn't even try to pretend I'm representing an objective point of view. I pushed to be appointed by then Attorney General Rob McKenna to the original founding board for 2 reasons. 1, as an advocate for rural voices in healthcare, drawing on my background as an EMT and as an architect, both in serving critical access hospitals in rural counties and as the project manager for the design team for the Shriners Hospital in Spokane, and 2, as an advocate for the legacy of Deaconess Hospital. My mother graduated from Deaconess School of Nursing in September of 1953. I served as a volunteer candy striper when I was in high school, and I was committed, and still am committed, to support the memory of the faithful deaconesses of the Methodist Church who founded Deaconess Hospital. Empire Health Foundation was formed when Empire Health Services, the 501c3 nonprofit that owned both Deaconess and Valley Medical Centers, was sold to a for-profit company based in Tennessee called Community Health Systems, abbreviated CHS. The sale of a nonprofit to a for-profit meant spinning off the assets of Deaconess and Valley into what's called a hospital conversion foundation to carry on the nonprofit purposes of the original 501c3 nonprofit. We had many conversations in those early days of forming the new Empire Health Foundation, EHF, about carrying on the legacy of the deaconesses in serving the community. And we also discussed how we could best serve all of the community. The Attorney General defined our service area as Spokane County and the 6 surrounding counties: Whitman, Adams, Lincoln, Ferry, Stevens, and Pend Oreille. At one of the early board meetings, I made a presentation on the characteristics and cultures of the counties outside Spokane to introduce some of the more urban board members to that larger picture. There is a diversity of political cultures across those 7 counties. The founding board and the first CEO for the foundation, Anthony Chang, made a decision to establish a position as a neutral convener, a place where those diverse cultures could find common ground. I miss Anthony's leadership. EHF then was committed to presenting information to the legislature from a nonpartisan position and building working relations within both parties across many viewpoints. I was personally invested in helping build those connections. And that's why I am a particularly ticked-off former board chair. Zeke Smith, the current CEO, was hired in late 2020. I have had a number of conversations with Zeke, although he declined to speak with me on this particular issue. He is a social justice warrior and sees advocacy differently than the original vision of the board. In one early conversation, when I pushed my heart for serving rural areas, what I heard him say, and I'm not quoting, it was several years ago, but the message I heard through my irritation was that most of the people were in Spokane, so we mattered less. It did not make me a fan. While I was on the board, we also discussed the possible benefits of having a separate 501c4, 501c3. They come under some different rules, some different restrictions, and we didn't really see the need. A 501c3 has to be more careful about testifying to the legislature or lobbying. It can be done, but it must be done without partisan bias in the interest of educating people about an issue, or the IRS can step in. And that wasn't a problem for a foundation committed to nonpartisanship and focused on serving tangible needs. But a bit more background on the formation. Besides taking on the assets of the two hospitals that were purchased by CHS, EHF took on their liabilities, pensions and unresolved malpractice claims, and was given the responsibility to monitor CHS for promised investments in the buildings and facilities and for a specific level of charity care to be maintained. EHF sued CHS in 2017 over inadequate charity care. I mean, people who were being billed and charged who should not have been. The lawsuit was settled in 2019. CHS agreed to absorb $47.5 million in patient debt, paid EHF $2 million in legal fees, and as part of the settlement, paid $20 million into a brand new 501c4 organization called the Empire Health Community Advocacy Fund. No more neutral convener holding a nonpartisan stance. Zeke Smith has pushed EHF into the deep end of the progressive political pool by using EHCAF to dabble in politics. When EHCAF gave $240,500 in cash plus in-kind contributions to a progressive political group led by a man who pled guilty to second-degree murder and had no experience in political campaigns, it looked irresponsible. When I asked Zeke by email what the process was for EHCAF to take political lobbying positions, Zeke answered by email saying ECAF currently doesn't have a policy. Before I'd be giving away $250,000, I want to be very sure there was a process in place. A process that didn't involve ingratiating ECAF with progressive politicians. And you'll be able to see on the Substack, you can see a copy of that email correspondence that we had on my questions and his answers. And like I said, I'm not a fan, and I'm having a hard time being gracious about the motivations for dragging EHF off track. And actually, I can offer some grace. I do believe he means well. There's nothing diabolical going on here. I just think he's wrong in very many ways, and it hurts to watch something I put my heart into being transformed. So I also asked about ECAF's decision not to file with the PDC as laid out by the Disclose Act. Zeke's defense was that ECAF staff conferred with the PDC about this and determined the organization is not required to file with the PDC. That's a quote. And here's the problem with that statement. It implies there was advice given by the PDC which EHF relied on. The PDC does not give advice or make preemptive determinations of complex questions. ECAF is a 501c4, totally controlled by a 501c3, with a paper-thin separation of formal structure. Zeke and 2 EHF members make up half the board. And my correspondence for ECAF came from EHF staff. Maybe they were wearing another hat when they hit send, but it's definitely fuzzy. And the funding sources matter. EHF has different funding. EHF had funding from the Department of Commerce. EHCAF had funding from another foundation. The funding sources matter, and whether ECAF needs to file with the PDC for lobbying is not a simple question, not something the PDC would ever have answered. The PDC will now have an opportunity to make a ruling. I filed a complaint, and it will be following it through the cumbersome process. It's going to take at least 8 months, might be a year before anything comes out of it. It's one of the frustrations that people have with the Public Disclosure Commission as a way of holding people accountable. The only kind of watchdog really is somebody in the press who sees something and brings things to light. A complaint will also be filed against Justice Not Jails for misleading the public by listing Empire Health Foundation on their campaign literature when they should not have, and when they should clearly known that they should not have, unless that fuzzy line was made fuzzier in their own correspondence with ECAF. Jails for Justice has since diverted money, since they've got so much, they've diverted it into other political nonprofits, all progressive leaning, including one usually targeting progressive get out the vote work in Seattle. Hardly anywhere within the area that EHF and presumably its 501c4 would be interested. Besides losing status as a neutral and trusted source of information, besides the damage to reputation, what bothers me the most is the $20 million settlement from the charity care case diverted into what now looks like just another political slush fund. We started this foundation with the vision of the deaconesses in directly serving the poor and needy. We don't need any more money in politics. Be sure to subscribe for notification of new content, either with or without a pledge, and thank you for joining me on this very personal edition of Forthright.